David Weidner.
And I'm Taylar Greene.
And I'm Olivia Wright.
And we are juniors with Carroll College's nursing department. For our SURF presentation, we decided to center our poster over Alzheimer's disease. We started with the question that we wanted to answer, and the question was, in adults with Alzheimer's disease, how does using traditional pharmacological therapies compared to using complementary and alternative medicine, also known as CAM therapies, affect the management of the symptoms of the disease? For background, and why this is important, Alzheimer's is the 6th leading cause of death in the United States, and it's the most common cause of dementia. Alzheimer's disease is a degenerative brain disease which primarily affects people over the age of 65. There are 3 stages of Alzheimer's disease, which include the early, middle, and late stages. Alzheimer's disease can affect independence through the manifestations of hallucinations, delusions, irritability, nighttime behavior disturbances, and cognitive impairment. Unfortunately, there is no cure for Alzheimer's disease. However, alternative medicines and traditional pharmacological therapies can be used to manage and improve the symptoms of Alzheimer's disease. CAM therapies positively affect the longevity, quality of life, and independence of people with Alzheimer's disease. Some therapies are going to include things like herbal remedies, dietary supplements, medical foods, exercise, and music therapy. Originally, we've looked at several different articles about complementary and alternative medicines for Alzheimer's disease. We ended up picking 6 that best demonstrated the correlation between CAM therapies and improved quality of life for people with Alzheimer's disease.
So the process we used to answer our PICO question was through systematic review, which means to evaluate the articles based on their level of evidence. Evidence strength is graded on a 1 to 7 scale, with 1 being the highest level and 7 being the lowest. So for Article 1 here, it looked at the effects of a stepwise multidisciplinary intervention for challenging behavior in advanced dementia. And this was graded as a Level 2 randomized control study. For the findings here, we found that the results suggested the intervention worked better than the control. Participants were less likely to receive medications in the intervention group compared to the control. The implementation of the STA-OP intervention did improve overall agitation, depression, as well as other neuropsychiatric conditions. With Article 2, it looked at the impact of antipsychotic review and non-pharmacological interventions on antipsychotic use, neuropsychiatric symptoms, and mortality in people with dementia living in nursing homes, a factorial cluster randomized controlled trial by the Well-Being and Health for People with Dementia. And this was graded as a Level 2 as well. For the findings, we found that the article was significant in improving in neuropsychiatric symptoms using adjunct therapies when compared to the control group who received just pharmacological interventions. With Article 3, it looked at combining drug and music therapy in patients with moderate Alzheimer's disease, and this is also graded as a Level 2 randomized controlled study. For the findings part for this article, we found that the AMT to pharmacotherapy had no further benefit to language and verbal communication compared to just pharmacotherapy in patients with moderate AD. AMT group compared to the M group alone had an improvement in psychiatric symptoms. With the fourth article here, it looked at adding Chinese herbal medicine to conventional therapy, which brings cognitive benefits to patients with Alzheimer's disease. And this was graded as a level 4 retrospective cohort study. For the findings section for this article, we found that CT plus H was significantly more effective than just CT alone. And patients treated with CT plus H had a stabilization of cognitive function after 24 months versus just CT alone. And the distinction between CT and CT plus H grows more profound over time. With the fifth article, it looked at Shiatsu as an adjuvant therapy for depression in patients with Alzheimer's disease. And this was graded as a level 2 single-blind randomized controlled study. For findings, we found that the improvement in the activity group compared to the control group, the GDS outcome showed a significant improvement. Other outcomes were not statistically significant. Adding Shiatsu to standard pharmacological and physical interventions significantly reduced depression in patients with AD. And for the sixth article here, it looked at the management of behavioral symptoms of dementia in a specialized unit care. And this was graded as a level 4 peer-reviewed prospective study with systemic analysis of data. For the findings, we found that there was no significant loss of autonomy on the ADL scale for walking. Significant improvement in the mean of NPI-NH scores after discharge. Some disruptive symptoms were significantly decreased when patients were under care, and depression and anxiety symptoms improved.
So, as a result of our research, we kind of concluded that with all of these different therapies, with the addition of pharmacological treatments, they can improve symptoms, but it's just temporary. Most of these studies looked at people and places over just a couple months. They weren't very long term. The last study that we looked at was a perspective, which meant that they're looking towards the future, so that is good in the effect that we can look at that long term and see how these symptoms are controlled long term. However, most of these studies are just short term, and so we saw that the combination of CAM therapies with traditional pharmacology is beneficial in reducing patient symptoms just temporarily. And usually when the patients stopped taking the CAM therapies with the pharmacological interventions, they had a degeneration of their symptoms, and they progressively got worse. But for nursing implications and applications to further studies, there are a lot of CAM therapies out there. There's hundreds of thousands that you could probably think of. And so the addition of any or all of these CAM therapies to traditional pharmacotherapies, it's been shown as an effective way to diminish AD symptoms in mild to moderate cases. Most of the studies appraised were found to be overseas, so a lot of these didn't take place in the United States. So further studies in the United States would be beneficial, just because our healthcare system is a little bit different from other healthcare systems around the world. So we don't know exactly how those interventions would translate over to the United States. We don't know if they would be the exact same efficacy, or if we need to improve or differentiate some of the therapies to fit our needs in the United States. And as always, nurses always need to advocate for their patients. They need to study up on efficacy of CAM therapies. They need to look up at new pharmacological therapies. There's a lot of different places where people are placed when they have Alzheimer's, so there's a lot of long-term care facilities. So using these therapies and advocating for their patients in these facilities is essential to help people with Alzheimer's disease try and get better, try and improve symptoms, try and decrease behavior associated with it, improve ADLs, decrease depression and agitation, and hopefully improve cognitive function. Even though there's no cure for Alzheimer's disease, we can still improve function and symptoms in order for people to have a good life still. And then finally, we can always, nurses, anyone can have research studies. We can head research studies, anything to just try and increase the research in the area along with Alzheimer's disease and CAM therapies. And then obviously long-term side effects needs to be studied more, because most of these were just a couple months and they didn't look at long-term effects. They just looked at the immediate effects of these therapies. So this was our presentation.
Thank you all for watching.
Yeah, thank you.